Oh, she's early. Okay, welcome to Thursday of crossover week and the House Human Services Committee. This morning, we are going to take up H 657, our omnibus DCF bill, and then we're going to move to another DCF bill on homelessness, 766. Or it's not really 766, but you know what I mean. Katie has had a busy, how many hours it's been since you got back from vacation? I don't know, but it's been busy for you, I know. So, and I know we've kept you busy with lots of versions, and we're only one committee, and you've got lots of other things going with other people and places and committees. So, I just, really want to say thank you for sticking with it. We are so very fortunate to have somebody who has been in this topic area for such a long time that it feels like you can sort of read our minds to some extent. So really, I mean, it's not, and I realize that not every committee is as fortunate as we are. They have new folks, and those new folks are great, but having people that you've worked with for a long time who are so competent and do the job so well is really, we consider it an honor to have you in our committee.
That's very sweet.
Now let's get to work.
I was waiting for that.
Well, Dan. Oh, Dan's with me for a long time. Okay. So you should be able to see on our website now, version 6.2.
Right. So I'll just say I made some of the changes. I sort of made a checklist as I was going, what I was able to do and what I wasn't able to do. So there's items on the list that have not been addressed yet.
I was just going to print out a copy of the list so that I had it.
Okay, I have it.
And the printer is jammed.
Oh,
So but you've got the list.
We print to the copy room.
It's okay.
They can bring it down.
Yeah,
Okay.
all good.
Okay, there we go. I don't know my, sorry, I'm trying to get to our committee's webpage and my iPad is not cooperating. So one moment here.
Can we also talk about the reach up section at some point?
We're going to go back over.
Changes made there? I just been.
Yeah, we're gonna go through the
Okay.
whole thing again. Yes. Okay. All right, all else works. Fails and. Okay, draft 6.2. Okay. Are we looking just specifically at your sections right now on 6.2, or you want us, should we just start from the beginning?
Up to you.
Well, this is the day that we vote on this bill. So let's start from the beginning and go through and make sure that we've gotten everything, or if there needs to be additional discussion. Okay? Yeah. So it'd be great if you could pull it up on the screen,
Yeah.
Katie.
I sent the link, but it's.
Okay, it's not
I
going.
just got it.
Okay.
Um,
I always say, because we're the furthest away from some server someplace that we must, our internet connection doesn't seem to be as. Okay,
Sometimes I turn it on and off and it works way better.
does it?
Yeah, if you go into settings,
And then do it, yeah.
shut it on and off.
Okay, so this is draft 6.2, change highlighted in yellow. The first section was the removing of the reach up asset. We went back and forth last time we met about whether B should be struck. I think I was convinced after that conversation it should be struck, so I went ahead and did that.
Right, so this is where, Jubilee, yeah, some questions.
Yeah, I guess now it looks like, I'm wondering if you could explain it to me, because it looks like to me now there's nothing in statute and the commissioner just decide, they make rules. And so those rules could be, there's a $500 asset limit. I don't understand really, I guess, what this means.
So this is eliminating the asset limit in statute. I don't think that would necessarily give authority for the commissioner to create one and rule. But if there is concern that that could happen, you could, replace this language that's being struck through with an affirmative statement that says there shall not be any asset limits in this program, something like that.
I think that that's probably a good idea.
Okay, let's do that. Okay.
Thank you.
Next is the Social Security benefits for youth and foster care. You have your definition section. And then you have the language itself. You rewrote this subsection B to read upon the request of the child or the child's foster care provider. The department in its capacity as representative payee for a child may use the child's Social Security benefits for the child's unmet needs beyond the amount that the state is obligated, required, or agrees to pay for the care of the child.
So Dan, do we have revised language here? Because we're supposed to have revised language here. From the department's feedback. You were gonna get Katie.
I'm sorry,
On the staggering, the implementation.
yeah,
Are we just gonna,
we're gonna implement the whole thing in a year.
okay.
And that's in the effect.
And that's probably down the bottom.
Okay,
Sorry, I
okay.
missed where you were going with that.
Yeah, no, that's all.
Yeah, it should, is it down
It
the,
is.
Okay.
in the
Okay, all
effect.
right, okay, great, all right, all good, thank you.
Okay.
sorry for the delay there.
No, that's all right, I was like, oh.
Something was that.
Yeah. Oh, man, that's some caffeine.
Sorry. No, it was down the bottom. I was like,
Where is it? So, that's just in response to the, department's,
Mhm.
request. They were requesting, trying to stagger implementation with different ages. And we took a simpler route by saying, let's just put it off so that they have an opportunity to plan for it. So we put off the implementation.
and I believe that is in section 16, line 15.
Okay, thank you.
Next is subsection C. The leave-in language is in its capacity as representative payee for a child and with the assistance of the state treasurer, the department shall. There's new 4, appeal any denied application for SSI benefits submitted on behalf of a child. And a change in 5, provide an annual accounting of the use, application, or conservation of the child's Social Security benefits, including any payments made under subsection B of this section to the child, the child's parent, legal guardian, or counsel, and family division of the Superior Court in the Office of the Child, Youth, and Family Advocate.
So I know another point that came back in feedback from the administration was that they do very few applications even, and that they don't currently have the staffing capacity to even think
Right.
about doing appeals. So, if we
Do we-
want to, if possible, or you want to,
I guess I saw that.
Yeah.
And I guess my thought about that was that because there are so few applications that they do, that filing an appeal shouldn't be that onerous
right, we're not saying you must file for every.
for everyone. We're
Right,
saying for
right,
those that
right.
you've applied for.
That's fine,
So I was okay with it.
okay.
And I just want to be, I want to be crystal clear with members. So this is our walkthrough, our final walkthrough of these sections. So that means if you have an issue or a question, you got to bring them up now, okay? Otherwise, it's presumed that you're okay. Or at least that you don't have a question.
Okay. Next is the unaccompanied youth, some changes in this section. You move the language without the consent of the parent or guardian up in subdivision 2 instead of having it appear 2 other places within the text. So without the consent of a parent or guardian, a certified unaccompanied youth may use the completed form 2. And then that language has been removed in this list. And instead of obtain a student loan, you have apply for a student loan. Subdivision E2 for the purposes of implementing subdivision C2I of this section, which is the banking, the Commissioner of Financial Regulations shall instead of may ensure the minimum use certification requirements are met for the purpose of making it legally permissible to bank for a bank, credit union, or insurance company to contract with an unaccompanied youth without the consent. Can't remember what the previous word was, of a parent or guardian, and with the understanding that the unaccompanied youth may not have a permanent physical address. And then this is hopefully in the correct section now. Nothing in the section shall be construed as altering the interstate compact for juveniles. I had it in the wrong section yesterday.
Yes, it is.
Yes.
Success. For
And
A,
that, for folks, that again is feedback from the Interstate Compact Officer at the Department for Children and Families.
Section 4A is the criminal aiding of a runaway child. You had a lot of conversation about this, but didn't ultimately make any changes to it. Next, at the top of page 11, if that's helpful, are a series of sections allowing unaccompanied youth to obtain different services and documents. So the first is the vital event certificates. Section 6 is the non-driver identification cards. Section 7, license and privilege cards. Section 8, learner's permit. And that brings us to 9. So now we're in the mechanical restraints and transportation.
Any question on that whole area? Okay,
I kind of want to call this just transportation of children because I think it's now broader than just
Yeah.
mechanical restraints. What page is that? 16. Okay. Let me mark it before I lose it. Okay.
You're talking about the reader assistance or? you're talking
Yeah,
about the
reader
section?
assistance. It started as mechanical restraints and I think it has expanded. So now we have our definitions as A.
okay,
I realize why I did it. It's because it was an existing section, so I was just topping it down at the bottom, but it was easy to change.
okay.
So I don't think there are any changes to the definitions themselves, just the order. And so now you see highlighting because everything has been relettered, but no changes to B itself. C, we have some changes, and the change on 15 and 16 was from the email this morning, Representative Donahue, if you're tracking what we have caught and what we haven't caught. So the Commissioner for Children and Families shall have the authority to designate the professional or law enforcement officers transporting children and shall authorize the method of transport. A contract for transportation services shall include the requirements in this section. Transportation services with non-contracted law enforcement officers shall only be authorized in emergency situations or by court order.
There's some slight tweaks that'll come to this only because I forgot to highlight some parts when I sent them to Katie. Do you want me to give brief background on the sheriff's
yeah, and-
dialogue? Because that's this part.
Just
Yeah.
a moment. Lori, did you send the Zoom link to Sheriff Anderson's?
Yes.
Okay. And he's not on though, right?
No, he,
Okay.
and I think.
Oh, okay. I just wanted to make sure that
Yep.
he had the opportunity.
Yes,
So just as an FYI for folks, the sheriff's approached us after our hearing yesterday and had some feedback and input. So Anna took care of it.
right. So the way he read some of the language, he was very concerned about, and it turned out it was really had a lot to do with structural clarity for the sheriffs rather than a substantive. I took his input, discussed it with him, got it to Katie. She did the redraft. There were some tweaks in some areas, and then the main part you'll see is around the documentation and focusing on guiding the sheriffs through the steps that need to be taken rather than it being kind of where the documentation comes attached to different pieces. He saw the language that Katie had done, was very pleased. And he said he, first of all, offered if during our discussions, when we're on that part, if there are any questions for him, a quick phone call and he will link on right away with the contact. He'd be happy to do that. He also said he might try to sit in for parts of it, but probably not have the time to sit in for all of the markup. So
He just entered the Zoom,
Hmm?
Zoom room. He entered the Zoom room.
okay, perfect timing. Okay.
Want me to pull this down?
Just for a moment, yeah. Hello, Sheriff Anderson.
Good morning, Madam Chair.
Hi, Representative Donahue was just going through the conversations that you all have had, and we are just entering the part about transporting children. So your timing was perfect, and Katie McClin has a new draft up, so you'll see it on the screen momentarily. And it's on our webpage also, and it's draft number 6.2.
Thank you, Madam Chair. I was listening on YouTube, which is how I was clairvoyant and when to join. But I heard Representative Donahue's discussion and certainly agree with everything she said so far. And I'm happy to not say anything unless you need me to.
All right, thanks so much.
I have a question for him.
And let's go through the section first, okay?
Okay. So I gotta pull it up. I gotta go print it out. I didn't know, I got the wrong one.
Okay, go ahead, Ann.
Okay, so as I just referenced that, the lines 14 through 17, there's another little, I think there's still a little tweak there.
You want to give it to me now?
Well,
Well,
it was part of the list last night. Maybe you've done it.
number one. I think I
Yeah.
have that.
Oh, you have that. Okay.
Contract for the Department for Transportation Services shall include the requirements of this section. Was the.
Yes, okay,
was the
that's
change.
right.
Is that right?
Yes.
Okay, great.
Yes, thank you. I don't have mine, so I couldn't tell. So the main part, and then the next part is actually about the education materials. Just to clarify in terms of the contractors, that it made it sound as if they had to verify that they took some other training course, as opposed to that they reviewed the materials sent by the commissioner. So that's that clarification on line 1 of page 18, and then lines 3 and 4. Lines 5 through 7, I think that was just moving language to make it consistent. I don't think there's any change there. The major change is really beginning with line 8. In order to make the flow more logical, after the part about the policy of the state of Vermont, that's where we moved the exact language about soft restraints being the first option as part of the policy of the state. And then with line 14, Katie, I don't know if you want to take over the walkthrough, which is, I'm sorry, I was sort of was at to intro it.
You're
and
kind of in between.
Yeah.
In between, so,
Yeah.
Go
So
ahead, go ahead.
the restructuring is with G, so.
Okay, well, you have more context than I do. So G is a restructure. So the entity that is contracted pursuant to C shall provide documentation to the department for the use of restraints when. And this is a list it's a list that is or, so there are different situations. Number 1, the entity believes that the risk of serious physical harm to the child or others requires the use of soft restraints before or during transport, including a description as to why less restrictive interventions could not reasonably be attempted, or why the attempted use of less restrictive interventions was unsuccessful. Or the entity believes that the risk of serious physical harm to the child or others was such that soft restraints were not adequate for safety and shall include a description as to which restraint was used and why soft restraints were deemed inadequate for preventing the risk of serious physical harm to the child or others. Or the use of waist shackles was determined to be the sole means of preventing serious physical harm to the child or others and shall include a description as to why waist shackles were the sole means of preventing the risk of serious physical harm to the child or others. And then in subsection H, we have language about documentation of the restraints. So documentation for the use of restraint shall be completed prior to transport unless the circumstances that required their use occurred during the course of the transport, in which case the documentation shall occur after the completion of the transport.
And then I did have another note. I think we're gonna flip J and I just because of the logic of the sequence.
This is the flip. Oh, did I do the flip in the wrong section?
It's I,
I might have flipped it in the,
Yeah, Jay. should
well, we
be
can just,
before
yeah,
I.
J should be before I.
Okay,
because
well-
that's still talking about the use of weight, and then afterwards is the supervisory review.
so when we get to the restraint and seclusion section, that's the I and J I flipped this morning, so we have to unflip those.
Okay.
So I have a question. And, so I'm just curious about why the, I guess specificity for when documentation is done.
I can briefly, but then if the sheriff wants to weigh in.
Okay.
He was, the way it was worded before, it wasn't clear. He was saying, well, you're saying we have to know in advance if something may happen during the transport. We have to know and document then that how would we know that in advance?
Okay,
So we wanted it clear that if it's a decision being made prior to the actual transport based on behavior or what, the individualized factors, they would document then. We made the decision we had to use soft restraints because, et
okay,
cetera.
okay,
But if it's during the transport, it doesn't, they thought everything was fine and then all of a sudden the child starts doing something.
Yeah.
And they have to do it then. They wanted it just clear that they wouldn't,
right, that's.
they wouldn't have had to,
violation.
they wouldn't have had to predict that, nor would they have to pull over when they're in the midst of the crisis and make sure to document it. That circumstance would mean they would do it afterwards. So they wanted that reassurance that they wouldn't be in trouble for not pre-documenting.
So my basic question is, why do we have to have a time frame? Now, I don't mean the distinction between before or after. Why aren't we just saying documentation has to occur? Is it important about whether it's before? I'm just,
Well,
I really, it's just a
Yeah.
question.
I
I'm
kind
not,
of like it. I think it's that intentional thought process and documenting it and then
kind of.
rather than an afterthought and after the fact.
After the fact.
right, you're supposed to be making an intentional decision.
Yeah.
Prior and not, yeah.
Okay,
And that's their existing, it works with their existing form.
okay.
Which
And
is
it
what
helps
they're
people
gonna be
think
able
about
to-
it.
yeah.
Okay. Sheriff Anderson, does that capture the concern that you raised about, mid-transport circumstances that arise?
Thank you, Madam Chair. For the record, Mark Anderson, Wyndham County Sheriff, and I think I'm here in my capacity as the past president of the Vermont Sheriff's Association. Yes, it does generally address the concern. The question you raised, Madam Chair, is one that Representative Donahue and I also discussed. I'm agnostic to the approach. We just want, as a current practice, DCF already tells us when sheriffs are involved in a secure transport, what they believe is going to be necessary. We have a history of self-harm, harm of others, or a risk to run. And so we may make considerations based on the youth's history or their present demeanor of how things are addressed. And that's the process I would defer to DCF, how they assess. But they already do tell us that in advance. When the event occurs and it's not expected, then we want to be able to respond. And that's part of the reason in the service that sheriffs provide. And in these limited niche services, you've already received testimony of how limited it is that we're actually involved. But the reason we're involved is usually some of the most critical and in some cases manic issues that DCF is dealing with in some of these populations. So we have a unique skill set and unique laws that apply to sheriffs that don't apply to other providers, which is why we are still operating in this space, even though the policy in the last 20 years has generally shifted to other providers doing some of these things because it's better for trauma-informed interaction with youth. So yes, it does. But that said, I'm also agnostic if there's a different way to look at it. I hear it. I just don't have words to provide that may make it better for others. But I'm also not upset with how it's presented here.
Thank you. Thank you. Yeah, I was just like, I think you both answered my question. So, okay, thank you very much.
So, and I want to say in part, Jay, I actually added something based on our discussion, but not based on outside input. And so that, you know, just to be aware of it, because there was a lot of concern about allowing any use of waist shackles. And that's included the language that was discussed yesterday about age. I added for possible that only designated law enforcement agencies, because they're the ones trained. And my understanding, which could be contradicted, is the private agencies who do this, they don't even carry them. They don't. But just to make it clear, they are not authorized at all to use waist shackles, because that really is a highest level.
It's an elevated
Yeah.
restraint.
Yeah.
Okay. And then also, just for readers, I and J here will be reversed.
So that the commission, so it covers all of the documentation.
Okay, and so that seems like a good spot to Representative Steady. If you have a question for Sheriff Anderson.
Sheriff Anderson, I've been working with a sheriff in another county, and he had concerns that a 12-year-old, he said, is bigger than them. And do you remember, I don't want to say any names, about a sheriff that was hurt a couple years ago when, I'm trying not to say any names, when restraints were considered and then they were put into a particular, and a sheriff was hurt. He said 12-year-olds are extremely large and sometimes larger than him, and he's a big man. And so he was concerned about the age 12. I just wanted that on record in case in the future a sheriff does get hurt.
Is there a question, Representative Steady?
The question is, do you feel a 12-year-old, this is a good age? That's it. That was my question. Do you feel 12 is a fair, accurate age when another sheriff is telling me that some of them are bigger than him? That's my question. I won't say the sheriff I'm working with.
That's okay. To answer your question, on behalf of the Sheriff's Association, I can't give you a definitive answer because I have not asked that question of the association. That said, from my personal experience, I have interacted with youth as young as 6 years old, and this is extreme. It's certainly an edge case, but youth as young as 6 years old who are as tall as me. I'm 6 feet tall.
Thank you. That's
there
what
have
I
been
wanted on
times
record.
that if we use an age similar to like airbags, if we use an age, we can run into things where it's like, well, we have a 6-year-old or an 8-year-old or a 10-year-old who's tall enough to sit and heavy enough to sit behind an airbag. But is it also a good rule that don't have youth sitting in the front seat where an airbag can harm them and use discretion? So
I would never.
I'm certainly a fan of allowing discretion for law enforcement. We do not normally testify before this committee, but there is a significant depth of training, policy management done for the law enforcement profession. And so if there is a policy decision of this committee to say that there is an age line, and so be it, happy to provide.
I just wanted it on record. And for the sheriffs and for the children, because they can hurt themselves. Thank you. Okay.
Ann or Katie? Yes, we're back to you, Katie.
Okay, I'll pull the document back up. Okay, so we did I and J. That brings us to the reporting in K. You wanted this report to go to the Office of Child, Youth, and Family Advocate, so that has been added. And then the request was made instead of child for it to read, or children for it to read minors, for the purpose of the report.
It just, that was one thing. Well, I may have misstated yesterday which section we were talking about. My understanding is we wanted to use minors for the other sheriffs, to distinguish the state's attorneys, this contract, because that's how they address it. But that we wouldn't have changed the existing, because DCF and all of our other definitions, it would be child. So even though that would make the reports different, the language different between those two reports,
Back to
that we would keep child here and use minor for that next section.
Okay.
People following? Or do
I-
you want minor for
No,
everybody?
but I guess I am, well, we have age as a requirement, so it can say
Yeah.
child, yeah. Age is reported, so it doesn't, so you don't,
Oh, right, yes.
so, yeah,
Back to children.
yeah.
Okay. Okay.
I
Subdivision.
I just want to make sure people understand what we're talking about. That, so this is one report. There's another report by the Department of State's Attorneys and Sheriffs that we asked for a little bit later. And we specifically say minors there, because in the number 12 that they gave was only those minors who were not charged with one of the big 14. And the big 14 crimes, they treated as adults, even if they were minors, because that's what the law says. So we do also want to know. That's why we use the term minor in that. Because those are only court-ordered transports. Thank you, Katie.
And then in subdivision 2, once the department has upgraded its technological capacity in a manner that enables it to collect responsive data, the information specific to B, C, E, and F on the list above of this subsection shall be collected and included in the annual report. And then subsection L, annual report from the Department of State's Attorneys and Sheriffs. Added on the list of who receives this report is DCF and the Office of Child, Youth, and Family Advocate. The contents of the report has not changed, so you do have minors here. And 1. Next is subsection D, report restraint in transportation of children. I don't think there are any changes to this section. Section 11 is the use of force policy. And you removed DMH and from the consultation list and added Dale.
And for people in the room, we only removed DMH because they already have this. They already have this appendix.
Right, we removed all the references to
Yeah.
mental health transports because that's.
Already covered.
And that brings us to section 12, which is the seclusion restraint section. And there was a request to make it more apparent that this was not related to transportation. So I just took care of that in the heading, non-transport related, restraint and seclusion. And I'm gonna catch up on that stuff. Okay. So we made the flip of putting our definitions first. So that's what you're seeing here with the relettering. There's a new definition of seclusion. And this does track the emails from this morning. So I think this is the latest. Means involuntary confinement of a child in a segregated room or area from which the child is prevented or reasonably believes that the child is prevented from leaving, whether the door is locked or not. Seclusion does not include a voluntary timeout under staff supervision for a short period of time in an unlocked room at the child's request.
I think the sentence structure is a little off.
Okay.
The first part is okay, so means involuntary confinement of the child in a segregated room or area from which the child is prevented, or from which the child reasonably believes that it's the child that reasonably believes that they can't leave.
Or from, you say from which, again, from which the child. Okay. Let me just read it over.
Yeah, I mean, it needs a little bit of
Segregated
wordsmithing,
area
but
from which the child is prevented. From which the child is prevented, or from which the child reasonably believes that the child is prevented from leaving.
yeah, okay.
I can make that change. So this is just relettering. You opted to use the phrase risk of harm to the child or others instead of another or another person. So you'll see that change throughout this section. And subdivision D1, you asked to have 2 sets of language there to compare them. So this is a decision point for you. The first option is absent exigent circumstances. A staff member shall attempt other less restrictive interventions and determine that the less restrictive intervention was unsuccessful or likely to be ineffective. The second option, a staff member shall use other less restrictive interventions unless less restrictive interventions have failed or would be ineffective in stopping imminent danger of physical injury or property damage.
My first reaction seeing these last night was that the second one, I think, is sort of more standard language, and it takes out the confusing piece that was in the prior section. That's just. Don't know if the department probably didn't have a chance to see that, but I think that's more standard the way they function, and it addresses the problem we had with the vagueness, I think. Yeah.
Yeah.
Okay, everybody.
Okay. And then I added language about the adjacent garment. Sounds like this is not the right location. So we could look at the language and then maybe talk about where you want to put it.
Right, I just think it belongs with where we talk about the exception that allows a restraint in the secure residence rather than putting it up here where it's
Context.
it's not right. It's not quite the right context there. So
Okay, so the language itself is under no circumstances shall a garment adjacent to the child's body that restricts freedom of movement or immobilizes or reduces the ability of the child to move the child's arms, legs, body, or head freely be utilized. So that's pulled from definition. So now,
garment adjacent.
yeah. So why don't, maybe when we get to the place where you'd like it added, you could flag that and I can
Will do.
make a note of where to move it. Okay. Subsection E.
Survey, okay with that
I just
language. Yeah, go ahead.
question here. Were there, since our conversation yesterday, I was wondering, Rep. Donahue, if there were further conversations with the department or other groups about this adjacent garment piece, just for more context?
No, just the discussion we had
Okay.
yesterday. Nobody really knows
Nobody
where it
knows
came
where it
from.
came from or what it's.
But we don't want to just remove it from the definition because then that would imply
You could use
that's
it.
okay, whatever somebody imagines it.
So we're being
So-
explicit.
But we're being
I think about
explicit that no, you can't do this in any circumstances, including in the secure residence where there are some limited uses. So,
Yeah, I'm curious if it will end up changing anything in practice that is happening today. I guess that's my lingering question, but I think it is good. I would just.
Yeah. Yeah, I
Lisa
I could-
did
I
not
could not-
think it was.
could not in good conscience.
Okay.
You know, put forth a bill that can strap a child to a wall. So if they're using it today, they won't be after this is passed. Hopefully.
Right.
Okay, but nobody.
They don't believe they're using
They don't
it
believe,
today,
nobody
so,
believes it's being
yeah.
used, so. Which is good.
And subsection E, so it's relettered. The change in one is just the conforming language or others. Subsection F, relettering, conforming change or others. Subsection G, this is the use of administrator on duty. This had said the department, which I caught and struck. And it had a typo yesterday to say administer on duty. So now we have administrator on duty.
So, and I do need to inject an update for here because when we redrafted this language for the version you presented, we looked at yesterday, originally we matched, the department's regulations have restraint in one section, seclusion in another. So this 10-minute and 30-minute, which is their exact language, is in two sections, one for restraint, one for seclusion. Since we're combining them, Katie added, restraint and seclusion for each of those. And so she also had restraint seclusion for the 1 hour requiring the assessment. And I said, oh, you know, restraint, I mean, that's not something that's gonna go an hour. We shouldn't include that there and make it suggest that. So that was removed. The problem is removing it then implies, well, there isn't a 1 hour restriction at all, and there's no supervision required. So it was a little bit of a dilemma for me for wording. And I asked late last night, got the response first thing this morning, how we should address that. And their response was, you know, you can't just, it's at 30 minutes, it has to be re-reviewed. And then what would you say? Then at what point? They just said they thought restraint should go back in there. That they can't be held for more than 1 hour in restraint or seclusion, you know, without that assessment. And, you know, the likelihood is pretty remote. But the only other thing would be to put some kind of artificial, okay, here's the time limit. So that's the suggestion. I'm comfortable with that, but.
So, I mean, if we say restraint and seclusion lasting more than 30 minutes, an hour is more than 30 minutes, so I feel like it's already covered.
Right, but
I think
after 30 minutes, it requires clinical and administrative consultation. But if we don't have that in-person assessment to go beyond an hour, it's just, okay, after 30 minutes, you have to have the approval. But then after that, if you get approval for the restraint to continue, there's nothing that says the restraint can't then go on for 5 hours.
But your other concern is that by putting restraint in there, that enables it to go on for an hour.
Well, without it, it enables it to go on for any amount of time. Putting it there puts it at the same standard of there has to be an in-person assessment and authorization. So unless you wanted to do a parallel one that said not more than 45 minutes without, or not more than 45 minutes, period, as an absolute, rather than, I think it needs something else as what happens after the 30-minute approval. I think it can't just be silent, so.
My concern is it takes a while for a youth to, because I used to be a substitute teacher, calm down. More than 45 minutes sometimes. They're so wound. It's dangerous.
Yeah.
This is a physical restraint. This is holding a child for.
I know, but if they're still putting out, they could put harm at themselves. They bat their heads against the wall. They do everything. You want to protect the child too. So if they're still in that mode, they could hurt themselves. I'm just saying, sometimes it might take more than 45 minutes for them to calm down and not keep batting their heads. I've seen
Let's
it.
add restraint back into
I'm
the.
just worried about the child too.
Um,
I don't want people to think I'm being mean, but I've seen it.
No, I think that's a chair suggesting that we do.
Yeah.
Yeah.
And the other
They
thing I
hurt
was gonna say
themselves.
is that it is sometimes the child's reaction to being in restraint that causes that as well. So I just, sorry, I felt I needed to say that.
But it's a catch-22.
Yeah.
It is a catch-22.
Yeah, all right, let's move on. Thank you, Katie.
No changes in two, subsection,
That's my.
subsection H.
Different comment is what I was.
Oh,
I'm sorry.
You have a different comment?
I do, and
Yeah.
unfortunately, like, cause I don't wanna linger on something too long, but, I still have one question about the garment piece.
Oh,
Oh,
And
okay.
whenever it's
we're going
appropriate.
back to it because we're going to where it goes in,
Perfect.
where it does go in.
Okay.
Whenever the time is
All right,
appropriate.
all right,
Oh,
good.
no, all good.
Okay, subsection H, nothing in this section shall be construed to include a locked bedroom during regular sleeping hours and a secure residence and seclusion, conflict with any law providing greater additional protections. Subsection I, no, I mean, do you want to go over the ones that are no changes?
No.
I, no changes, J, no changes, K, no changes. L, this was a decision point. You had discussed yesterday looking at the contracts
Yep.
and prior contracting with a state licensed facility, the department.
We can, I just, yeah,
Yeah.
so, we'll come back to this in a second, but, there is, I forwarded to folks, we got a copy from the Office of Child, Youth and Family Advocate and as well from the department about, what language, some fairly standard language is. And so hopefully you've had a chance to look at that. This is the decision point about whether we require them to out-of-state entities to follow Vermont rules, essentially. And we have a thought about maybe how to thread a needle about that. And I will say that the department does not want to include it because they say that will limit their ability to contract with out-of-state entities. And I'll be honest, I personally have a problem with that because if it's not okay in Vermont for the children we are serving here, I don't think there should be, that feels like discrimination to me for children who are served out of state. But we have some potential thoughts about it.
But we can go ahead with this. I wanted, it was just the continuity because we actually are going to move N and O sequentially to go with the other restraint and seclusion specifications. So I was going to jump to those, but we're into this now. Let's go ahead.
All right.
It's going to move to be later just to be the
Okay.
right sequence, but we can go ahead now.
So the proposal that I want to make is that we actually do require the department to include it in their contracts, but that this piece would not go into effect for 2 years. So that would give them an opportunity to have negotiations with the people that they use now. But I just can't have a double standard for children who are out of state and children who are in state. There's no treatment sense that makes sense about that.
I would add, we are moving towards, for instance, with the PTRF, bringing more children back where they will be here.
Yeah.
And if people are worried, well, what if that means they can't come up with, well, by having 2 years, the legislature is back in session. They could come back and say, here's what we tried, we cannot do it, and it can always be amended at that point. But this really says, this is what we want to have.
This is the policy that we should have. Yeah.
Structurally, I think what we would want to do, Madam Chair, if you want me to, just because I sent some things to Katie, that the first sentence in what's number 2, we actually would want to maintain. That's having to do with any contracting. For instance, contracting for a company that's going to come into the state and run our residence or whatever, that we do want that due diligence piece. And then number 2, it would be striking that second sentence and replacing it there with saying the contract shall require adherence to our restraint. Right.
Yeah.
Any contract.
Yeah.
And that part would be go into effect in 2 years. And then that next, that M, what currently.
It would say in state and then it would say out of state. Only the out of state would go into effect 2 years.
Yes, sorry, that's right.
Ask that.
Yes.
No, that's right.
First part, not go to.
Right. Number 2 only applies to out of state because in state, it's already required. And then M,
So why don't you, I think, Ann, you can deal with Katie on the
Okay.
sort of like order of things. I think we don't need to do that as a committee.
okay.
Okay?
So then what I was referencing before, N and O are the parts about the special secure residential exemptions. And so those are going to move to be together with the other
Okay.
restraint seclusion.
And we've got momentary initial hold. Katie, we're down on line 18 on that, page 28.
Okay. And M, it talks about, M, line 13, not subject to the department's rules. It sounds like that wouldn't be the case anymore. Do you want that?
Sorry, which,
Page 28, line 13.
We're on.
no, we're going to go back and we're going to talk about
Going
that.
to be
That's part of
rewritten.
what,
Okay.
the chair wants us to talk about and work
Yeah.
out afterwards
Okay.
and bring back.
Okay. N, notwithstanding subsection B, a child detained in a secure residential program may be restrained with mechanical restraints for a momentary initial hold. to enable relocation of the child to a less restrictive method of intervention, if necessitated to prevent serious and immediate harm to the child or others. So that's language from the definition of the prone restraint. Subsection O, updating the cross-reference and using the conforming or others. P, the department is to post on the Family Division scorecard or another prominent location on its website the rates of restraint and seclusion used on children and licensed programs, and instead of including the number of uses of secure transport and of restraint used during transport. Q, this is the rules that the department would develop and you added yesterday, and any other necessary standards. So it wasn't exclusive to the list that you had come up with. And that is the end of that section.
Did we say that yesterday? I mean, I don't remember, so I just want keep going.
Oh, you're right, you're on the next section. I
Yeah.
was going to explain it, but Katie hadn't got there yet, so, okay.
Keep going, or were we gonna go back to the adjacent?
Oh, the adjacent.
Oh, I'm
Sorry.
sorry. Thank you.
Where does that go?
That goes immediately after the section that, where do we just, let's see, section N is the special exemption for mechanical restraints. And the garment was part of the definition of mechanical restraints. So we go immediately after N, or maybe as a continuation of that sentence, however it works from a drafting point of view. That's the spot where we need to say, regardless of this exemption, no garment attached to something.
Yeah.
Or no adjacent garment.
Esme.
My question, I think I've answered for myself, but I was a little bit confused, at first looking at the garment section and being concerned about seatbelts because, in some cases, in DOC, I know that they neglect to give seatbelts for transporting prisoners. So, but I was reassured that the title of the section is
Yes.
non-transport related. So then I was like, okay, we're fine.
That was
Okay.
exactly what the sheriff had been concerned about, is like,
Yes.
are these gonna affect what we can do?
I see head nods.
Oh, good.
Devices where
Yes,
they could.
Totally get that.
Yeah.
I just want to make sure that we're unintended consequence and they're not. So that's good. Right.
Okay, thank you.
Thank you.
Okay.
So section 13, this is the report, children in correctional facilities. There is a work group that the departments are to consult with in coming up with the report. And the addition to this group is a young adult with lived experience of being detained in a Department of Corrections facility.
Just for folks to understand, you saw the language, this group, I shared, this is the language that I presented to the Corrections and Institutions Committee and we discussed here, had that, but I had forgotten to include that in what I sent Katie. So that's why
You're
it's
okay with
highlighted
that?
as new, yes.
Okay.
It's supposed to also say appointed by, because you have to say who's finding that young adult.
Okay.
So that's going to be selected by the office of the youth, child and family advocate. And I don't know the protocol, but I think that when somebody is not an officialdom and they're therefore getting a stipend, that you need to have a language saying the reimbursement piece.
Okay. Let me add the
That was
reimbursement.
a much later email last night that I was thinking about and sent.
Well,
Oh, and don't.
it applies to this one and the one that we talked about earlier.
Right.
That Jubilee worked on. too.
Yeah.
Yeah.
So,
Oh, the reimbursement language.
yeah.
I don't think we'll put it in separate places.
Okay.
Sorry. Okay, next is there's the reason why this 14 is highlighted is because we took the section on the scorecard and we put it into out of session law in a standalone section and into the section we just looked at. So we've lost a section. Proposal to extend supports for children over 17 years of age, no changes. This is the working group. Curious so the feedback from Nolan about the appropriation was that it would be less than 1,000. And he thought that it could just come out of DC-8 DCF's budget instead of having to do a separate appropriation for it. So I could do per diem language that just says from DCF's budget without appropriating anything.
Okay.
Let me make a note for myself.
It's less than $1,000.
That would be applicable to the other one we just discussed too.
Well, yes, and just to give DCF one little relief piece. In terms of the young adult on the correction group, where it needs the same language, the Office of the Child, Youth and Family Advocate has volunteered for that to come from their budget.
Okay, so.
Once asked. Oh, they volunteered.
They volunteered yesterday.
Oh,
Yeah.
I thought you were just asking. if
No, I was
they
just
agree.
verifying
Oh.
it before I said it.
Is their budget have any state funds?
Yeah.
Oh, so it'd still be the taxpayer dollars.
It's,
But it's no new money.
No money.
It's not new money. It's being taken from what they already
I know,
have.
but it's still taxpayer dollars.
Yes.
Thanks.
Okay, effective dates. So the effective date section itself, section 10, which is the report on restraint and transportation, section 11, which is the use of force policy, section 13, which is the report on children in correctional facilities, and 14, which is the proposal to extend the supports for children over 17 years of age. Those pieces take effect on passage as drafted. Section 9, transportation of a child, and section 12, the restraint and seclusion, takes effect on January 1 of 27. And it sounds like there's a piece of that that will take effect later. So you'll have a new section in the new draft. So those effective dates can work. Section 3, which is the Social Security benefits, takes effect July 1, 27. And all remaining sections take effect July 1, 26.
So the section 3 is the SSI.
Yeah, but you know, 2 should take effect on the same date because that modifies it. Let me take another look at that.
Okay, folks, so, so there's going to be that, Anne, will work with Katie on, that one section. And then there's a little bit of reordering. So I've asked, Anne to work with Katie to, come up with language that implements the requirements to include this in out-of-state contracts, within 2 years. And we are going to address the video question in that. So, just as that should be plenty of time to work out how to get that to happen. Okay. Okay. So, at some point later today, we'll be voting on this bill. I don't know exactly when that'll happen, but it'll be later today. Thank you, for all your work on it. People who have been spearheading it, appreciate it. Yeah,
Just here, Madam Chair, I've done a walkthrough of the, so I'm gonna step out.
Okay.
and try to work on that language to
Sure.
suggest for Katie.
okay.
Later.
Okay, so we are now going to shift gears. Thank you, Sheriff Anderson, for being here. Appreciate your flexibility and all the input that you provided.
Thank you for your time, committee.
Okay, we are going to shift now to our homelessness bill. And hold on just a second, because I need to get my notes out from last night.
Is that on the document?
We're still going, Madam Chair, with the document as posted yesterday afternoon, or morning, whatever that was.
What version is that? Does that say 4.1?
Yes.
Yes.
I'll go to yesterday.
So what has happened in the meantime?
There's a bunch of the non-collated.
Oh,
But there's 3, yeah, that mean, you'll have to break them out. They're like page 111.
okay.
2. Yeah.
Okay, so,
I don't mind breaking them out if you want.
do you want to organize them or whatever?
If it's possible, let's put
Uh,
the last page.
All right, why don't we, Lori, why don't we go off